Hello, everyone. My name is Dr. Ashok Agarwal, and I will be your host for the next 2.5 hours. And we are here to welcome you to the next online ART training in Module 5A, which is Overview of IVF and ICSI. Today is Tuesday, May 18, 2021. And this program is made possible by the American Center for Reproductive Medicine at Cleveland Clinic. Again, welcome to everyone. So here we go. This is my short biography. Um, for those who have not attended the previous program, I'm the Director of Andrology at Cleveland Clinic within the Department of Urology. I'm also the Director of Research and very much involved in research in the causes of male infertility. So our program is one of the most active programs looking at the research, focusing our research on causes of male infertility, looking at how we can find solutions that can benefit patients who have male factor infertility. The organizers and the speakers have no conflict of interest. No companies or outside entities were contacted for sponsorship of these events. This program was made entirely possible by the educational support by the American Center for Reproductive Medicine, and the webcasting was supported by David Reichling, David Wolfley from our Information Technology Division at Cleveland Clinic. Thank you to them. The course faculty who you will be hearing today have donated their time for this online training course. Program coordinators you will meet here have volunteered their time for this training. The names, images, and description of products and instruments that you may see in the lectures are used routinely in various laboratories, IVF labs, and these items are not endorsed by the speaker. So today's program, as you have seen, this is called Module 5A, which is basically an overview of in vitro fertilization and intracytoplasmic sperm injection. The program is supposed to complete by noon because it includes the part related to multiple choice. Our lecture component should finish within 2 hours. We have timed it. So the learning objectives today is talks related to essential equipment, supplies, and culture media, protocols for oocyte retrieval, oocyte denudation, and embryo transfer, oocyte characteristics and embryo quality assessment, and important parameters for embryo culture, monitoring, and quality control. In addition, we have two more lectures, one by Professor Hassan Salam and one by Kelly Athaije Virka. So these are the components of the today's program that you will see starting from in a circle, starting from equipment to oocyte retrieval, gamete quality, embryo culture, expert commentary, and then industry perspective, and a very brief conclusion. We introduce the next speaker. His name is Dr. Israel Maldonado Rosas. Israel is the owner and chief executive officer of IVF Clinic Sitmer with branches in 3 Mexican cities. He was trained as a clinical embryologist at Instituto Valencio de Infertilidad in Valencia, Spain, a very prestigious IVF institution in Europe, and received additional training at the Cato's Ladies Clinic in Japan, two very prestigious institutions. In 2020, Israel was recognized as the Embryologist of the Month by the American College of Embryology. He serves as a visiting faculty in our ART training program when it was allowed to have in-person training at our center in Cleveland Clinic, and he has been doing that for many, many years. So we want to welcome Israel, and now we will have his recorded presentation. Dr. Israel is also actually present today, like all other speakers. So
we'll talk about these embryo culture requirements. During this lecture, I will cover the following learning objectives, always trying to share with all of you our experience within the IVF laboratory. We will discuss the two types of culture media that are normally available in the market. I will also show the way we prepare our embryo culture dishes, considering that we like to use the microdrop system for all of our IVF procedures. We will further mention the most critical factors that may impact the embryo culture performance and how to keep them in optimal ranges, such as the use of incubators that provide 20% of oxygen concentration, or those that only provide 5% of oxygen concentration. We will also discuss the importance of the oxidative stress as another factor that affects the embryo culture performance. Afterwards, we will discuss the negative impact of an incorrect pH on the culture media performance and how we can maintain it into the recommended ranges. We will talk about the correct use of the mineral oil and how we try to avoid the formation of certain toxins in the mineral oil. Finally, we will discuss about the several troubleshooting, and I will share some tips and tricks we normally use in our IVF laboratory to solve several deviations observed on both the embryos and the clinical outcomes after the embryo transfer. We have two types of culture media that we normally use to culture the embryos until blastocyst stage, such as the sequential media and single-step media. Although the use of single-step media provides similar clinical outcomes compared to sequential media, I would like to mention that several years ago, we changed the use of sequential media for this single-step media. In our case, the main objective for selecting the type of culture media we use in our IVF laboratory is to culture all the embryos until blastocyst stage in a more efficient way, allowing us to culture the embryos from zygotes to blastocyst stage, trying to disturb the embryo culture the less as possible, eliminating the extra time and supplies needed to renew the culture media on day 3, and also diminishing the stress produced by the embryo handling. I would like to mention that we don't have a time-lapse system in our IVF laboratory. For example, when we need to perform blastocyst biopsy, we perform the sonadering at blastocyst stage just before the trophectoderm biopsy. And following this scheme, we only grade the embryos at day 2 of development and at blastocyst stage before the embryo transfer or before the embryo cryopreservation. But despite of the many benefits obtained from the use of single-step media, it's still important to take into account that this single-step media exposes the embryos to supra-physiological levels of glucose, especially at the very early stages of the embryo development. So this strategy still needs to prove that it is safer than sequential culture media. I would like to mention that despite of our desire to transfer all of the embryos at blastocyst stage, it's not always possible. And according to our experience, we only are able to transfer the embryos at blastocyst stage in only 97% of our cases. I would like to highlight that the overall cancellation rate we normally obtain for not having any blastocysts available for transfer is only at 3%. And the same 3% of cancellation rate we also obtain when we transfer the embryos at day 3 of development. This cancellation rate that is very low is one of the reasons to always try to transfer blastocysts in all of our IVF cases. It is clear that when we push the embryos until blastocyst stage, we add more developmental and morphological information from each embryo, allowing us to make a better selection of the embryos from the cohort to transfer. This strategy also allows us to diminish the number of embryos transferred, helping us to diminish most of the obstetric problems that occur to our patients and their babies during the pregnancy and delivery, and also to increase the pregnancy implantation and live-free rates compared to the embryo transfer at day 3 of embryo development. For the preparation of the culture dishes, we always prepare our culture dishes on a cold and sterile surface into a laminar flow hood. As I mentioned in this slide, the embryo culture dish preparation is a very easy step to perform, but one of the most important techniques to maintain the high efficacy of the culture medium. In this video, you will observe our protocol to prepare the culture medium dishes using the microdrop system. You can also observe that the culture medium bottle was brought directly from the refrigerator when every supplies have been already set to prepare the culture medium dishes in order to keep the culture media bottle out of the refrigerator the less time as possible. After this, we open the bottle of the culture medium and take the necessary volume of the medium according to the amount of work we will have next day, and the culture medium bottle is immediately transported back to the refrigerator. After this, we aspirate by means of a pipette 50 microliters of the culture medium already supplemented with the protein source, and put these 50 microliters of the culture medium at the bottom of a 60 millimeters sterile Petri dish, repeating this step several times until placing 8 drops of culture medium around the dish and 2 drops, as you can see here, at the middle of the dish. Immediately, we place a high volume of mineral oil according to the dish capacity. For example, for this 60 millimeters dish, we place 9 ml of this dense mineral oil to overlay the culture medium drops. And after we finish, we transfer immediately the mineral oil back into the refrigerator. Remember that the placing the correct volume of this mineral oil overlay on the culture dishes helps to avoid the drastic culture medium evaporation, even when we culture the embryos without any renewal from zygotes until blastocyst stage in either dry or humid incubators. About the embryo culture requirements, it is well known that the embryo culture medium quality is only one among the 200 external factors unrelated to the culture media that can affect the embryo culture performance. And among these external factors are the pH, the type and volume of oil overlay, atmospheric oxygen concentration, cell manipulation, etc. As you can see here in this image describes some of the important events that occur at very early stages of the embryo development. During the in vitro culture, just after fertilization, oocyte enzymes demethylate the sperm and the oocyte chromatin. And after this, new methylation marks start establishing on the embryo genome at zygote stage and during the formation of the blastocyst. Finally, it's important to mention that these epigenetic modifications are extremely sensitive to these in vitro environmental stressors. About the atmospheric concentration, even though similar embryo development and pregnancy rates can be obtained after the embryo exposure to 20% of oxygen concentration compared to 5% of oxygen concentration, it's clear that the exposure to 20% of oxygen concentration produces to the culture media higher levels of oxidative stress compared to 5% of oxygen concentration. So I recommend always culturing to culture the embryos at 5% of oxygen concentration instead of 20% of this oxidative molecule. This is because the in vitro culture of human embryos in a high oxygen environment constitutes the exposure to a known embryo toxin, which may be considered harmful and inappropriate. And on the other hand, it is well known that oxidative stress produced in the embryo culture media is not only due to the exposure of the culture media to 20% of oxygen concentration. So another potential hidden factors should be taken into account during the embryo culture period. So the question that rises is if the decreasing of the oxygen tension from 20% to only 5% by the incubators is a problem solved. To answer this question, it's necessary to mention that in 2018, the group led by Dr. Agarwal demonstrated that the levels of oxidation reduction potential, also called ORP, present in several types of embryo culture media are significantly different among them. You can see these reported values in this chart located at the left side of this slide. Remember that the oxidation reduction potential levels describe the balance between the oxidant and antioxidants present in either fluids or even in the embryo culture media. So by definition, the oxidation reduction potential is the best indicator of oxidative stress among other parameters described in literature. Unfortunately, these ORP levels present in the culture media can be accurately adjusted by the addition of antioxidants. And if you can see now, the image located at the right side of the slide, you will see that when we measure the physiological levels of ORP normally present in follicular fluid from oocyte donors, and these supra-physiological levels obtained from follicular fluid from oocyte donors can be set in the culture media by the addition of several antioxidants every 12 hours during the whole culture period from zygote until blastocyst stage, improving significantly the in vitro embryo development in different types of patients. These important findings were obtained and reported by our team, always under the leadership of Dr. Agarwal. According to our results obtained from these research projects, I would like to mention that still there is a necessity to adjust the supraphysiological ORP levels present in culture media every 12 hours, even when the embryos are cultured in vitro and are exposed to only 5% of oxygen concentration. It is important to mention that with this novel method developed by the group of Dr. Agarwal, the supraphysiological levels of oxidative stress present in the media not only can be scavenged by the addition of antioxidant, but the most important part is that it is possible to adjust the supraphysiological levels of oxidative stress to a physiological status compared to other methodologies that have been reported in the literature. Regarding to the pH in embryo culture media, I can say that although no evidence exists to indicate which pH levels is optimal for IVF, the optimal pH in our culture system is the one has been recommended by the manufacturing company of each embryo culture media, which normally ranges from 7.2 to 7.6. As the CO2 levels are important to maintain a correct pH, the CO2 measurements should be done using a certified digital analyzer instead of a fired gas analyzer. For example, if you see the image located at the right side of the slide, when we measure the CO2 levels of the same incubator, but we did it using a fired and also using a certified digital analyzer, so you can observe that the results displayed by the fired and also from the digital analyzer are totally different. So the more accurate results are gotten by the use of the certified digital CO2 analyzer. Also, the use of a real-time pH meter, especially designed to measure the pH in embryo culture conditions, should be mandatory, as you can see here in this video. The tempered electrode is placed into the culture media, already calibrated at 37 degrees Celsius and 8% of CO2, and wait until we obtain in real time the pH of the culture media. A part of this measurement of the CO2 levels, it is important to avoid as much as possible the drastic culture medium evaporation and changes in the temperature of the culture media to maintain the pH of the culture media in optimal ranges. No evidence exists to indicate which pH level is optimal for IVF, so the companies spent a lot of resources to assure the best pH range for their culture media to optimize the clinical results. Each lab need to work out and evaluate the pH conditions work best for laboratory conditions. And finally, I would like to add that it's very important to invest in the correct technology available to monitor in a correct way the main parameters to assure the optimal embryo culture performance in terms of the pH. Regarding to the use of the mineral oil, larger volumes of mineral oil with higher density not only maintains more stable the temperature of the culture media, but also helps to decrease the drastic culture media evaporation in humid incubators, and especially when we are culturing the embryos in dry incubators and we are using single-step media without any culture media renewal. Also protects the culture medium from microbial contamination, maintains appropriate the pH of the culture medium. On the other hand, according to our IVF protocols, we can say that we don't wash anymore the mineral oil with culture media to try to minimize the adverse effects of the mineral oil to the embryo culture media during the in vitro culture period, because with the current production of high quality mineral oils by the companies, this one has been done. So, and neither I recommend to test anymore in our IVF laboratories the culture media and the mineral oil by means of the human sperm survival motility assay, and also using the mouse embryo assay test, because manufacturing companies do it. Regarding to the mineral oil storage to prevent the photoperoxidation and peroxidation of the oil, I always like to storage the mineral oil in the refrigerator 2 or 4 degrees Celsius. Also, according to our experience, with the use of mineral oil or paraffin to overlay the culture media drops, both types of oil provide the similar results when we storage the mineral oil appropriately. For troubleshooting tips and tricks, I would like to share only a couple of scenarios that we can face during the IVF procedure. For example, for the scenario 1, what to do when the overall fertilization rate is diminished in the IVF procedure. So the solution, although many factors can affect this fertilization process in terms of the culture media aspects, pH may affect the fertilization rate if it is out of range, especially after conventional IVF as the insemination procedure. So correcting the pH may improve the fertilization rate if it is out of range. We need to consider that the oocytes don't possess any functional pH regulatory capacity to regulate the internal pH when the external pH in the culture media is out of these physiological ranges. So for the scenario 2, what to do when we have low pregnancy and implantation rates despite a transfer of morphologically excellent, very good, or both embryos. So the solution is, if we consider that the human embryos can develop until gaseous stage, even if they are cultured in an adverse environment, including this incorrect pH, sometimes we observe an acceptable embryo development, but the pregnancy implantation may expose this problem. So to verify this pH and also the gas level into the incubators is appropriate. Also change as soon as possible the batch of the culture media if it is possible. Also change the batch of the mineral oil too. So finally, for the take-home message, I would like to highlight that the culture media is extremely affected by external out-of-range conditions. The quality control is key to control any out-of-range parameter in order to assure a proper in vitro embryo development, it can appear unethical if we, despite of this information, don't act to assure the best embryo culture conditions. And also remember that the ultimate goal of the assisted reproduction technologies is to have a healthy baby at home. Culture media is not the only factors towards a healthy baby. However, it is one of the important factors that needs to be more carefully monitored. I would like to thank my IVF team at Mexico City, and also thank all of you for your time during this.
And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ACRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agrawal Cleveland Clinic, and you can send a request to join.